our second class of inflammation. So in this class, this is the class now which we are going to conclude the topic of inflammation. So before I start, don't forget to subscribe to my channel so that you don't miss out the next 4 important topics which we are going to also look at. So the video, I'll post them by the end of today. So the other videos which you have to look for is for tumors, and also what we are going to look at. After tumors, we're going to look at burns and how you can calculate what burns. So don't forget to subscribe so that you don't miss out the next video. So in the previous video, we talked about the definition of inflammation. We also looked at the types, which we looked at what acute. So we talked about acute, what acute is. We discussed the characteristics of acute, which we said is rapid, it occur minutes to hours, localized, only occur at a certain area. Then we also looked at the 5 cardinal signs, which we said redness, swelling, heat, pain, and to some extent loss of function. So now in today's video, or in today's class, we are going to be looking at the second type of inflammation known as chronic inflammation. So what is chronic inflammation? So whenever we are talking about chronic, you have to understand first the term chronic inflammation. So when you are talking about the term chronic, this means what? Long duration. So we said that when we are talking about acute, it's what? Onset. So meaning, whenever you hear the word chronic in front of something, just know that this is long, something which is occurring for a long time. So in definition, what can we say now is chronic inflammation? So whenever you are studying the types, make sure that you write a table to compare. So whenever you are revising, make sure you write a table on acute and what? Chronic. So this table which you are going to make will be helping you to compare chronic inflammation and what? Acute inflammation. This will help you, or this will help the information to stick. So be sure to write somewhere this comparison. So we said that chronic inflammation, this is a longer duration or persistent to response when there is what? Tissue damaged. So this now is long. We said that whenever you injure yourself, the first thing which happens is acute inflammation. Your body will try to repair it fast. But if that process fails now, it proceeds to what is known as chronic inflammation, which is now the longer duration. Response to ongoing tissue damage or infection. Yeah, so this is what you need to know when you are defining what chronic inflammation is. Then remember, we said that acute inflammation is what? An immediate response to tissue damage. So as you are studying or as you are revising, so make sure you write what are the definitions. I need to know the definitions. So you say acute is just what? An immediate response. Immediate. So don't worry, I'll come and summarize at the end of the video. So make sure you stick around so that you have this short summary which can help you study the topic of acute and chronic inflammation in less than 30 minutes. So be sure you stick around through the end of the video. So now let's continue with the chronic inflammation. So now we have discussed about the definition of what? Chronic inflammation. So now we are going to talk about what chronic inflammation can lead to. So we said that acute inflammation can lead to three things. One, it can lead to what? To elimination of the disease. Then second, it can also initiate the process of healing. Then third, we said it's for containing what? That infected area. But here under chronic inflammation, we are saying that this is a maladaptive response. So what do we mean when we say it is a maladaptive? So in this case, chronic inflammation does not help the patient, but it does what? It reduces his what? His health. How does this maladaptive response reduces or affect the individual? So it can affect this individual. One, this maladaptive response can lead to what? To tissue damage. So we said that once you injure yourself or once the mosquito bites you, if your body fails to repair itself in acute inflammation, it will lead now to what? To chronic inflammation, which can therefore lead to the tissue to be further damaged because you have failed to heal. So this is what is known as irreversible damage to tissue and organ. Yeah, so stick through so that you see the examples in which you can see that, okay, this is chronic inflammation. Here the inflammation is not normal. So another way you can remember this is acute. Acute, we are talking about normal. Then chronic, we are talking about pathological. This is abnormal. When you have chronic inflammation, it is an abnormal. Then when you have an acute response, it is a normal response to injury. So you need to remember that. So what is the second thing which this maladaptive response can lead to? So it can also lead to disease progression. This is how some disease start. So these are the two dangers of chronic inflammation. Why are we saying so? So it can also contribute to the development of various diseases. So it can also contribute to development of various diseases, in the sense that this is a persistent response which does not do what? Which does not heal. So therefore, other diseases will have a chance at entering your body. Yeah. So now we have understood what chronic inflammation is and the dangers of chronic inflammation. So now what are the characteristics? How can you identify now that this is chronic inflammation and not acute? Because as a nurse, you have to have that knowledge to distinguish, because if you fail, you might kill a patient. So characteristics, what are the characteristics? So remember the characteristics we talked about in acute, and we also have some characteristics which distinguish or which differentiates chronic from acute. One, it is what? Persistent. What do we mean when something is persistent? So remember, acute, we say that it is what? Rapid, minutes to hours. But here we said it is persistent. It can last for weeks, even months. To some extent, it also can last for what? For years to come. So this chronic inflammation or this condition can last for years to come. Then the second characteristics which you can identify that this is chronic is what? Systemic. It affects the entire what? Body, or it affects multiple tissue and organ because it is progressing. It is systematic. Yeah, then remember what we said on acute. We said acute is localized. It is only at the affected area. So these are some of the differences also. You can be noting them as you are studying. So what do we say? So systematic, it can affect multiple organs. Then third, we said that it is what? Maladaptive. So also maladaptive is a characteristic of what? Tissue damage. So we say that maladaptive, this chronic inflammation does not lead to healing of the patient, but it can lead to tissue damage and disease progression. Yeah, so these are some of the characteristics which you need to understand whenever you are looking at what? Chronic inflammation. So now moving on to our final part of this video, which is the examples of chronic inflammation. So what are some of the examples of chronic inflammation which you need to know? So we have examples. Yeah. So some of the examples which you can say that these are examples of chronic inflammation are, we have chronic diseases. So chronic diseases, I told you that whenever you have chronic inflamed, just know that this is a long duration. So the disease is there for a long period of time. So we have chronic diseases such as Mycobacterium tuberculosis. So TB in short. So TB in short is one of the what? One of an example of chronic inflammation. Then we also have another what? Another bacteria or another disease which is an example of chronic inflammation, which is syphilis. So whenever you hear syphilis, just remember that, oh, this is what? Chronic inflammation. So syphilis is caused by a bacteria which is known as Treponema pallidum. So These bacteria, you will learn them in your what? Microbiology. So, what is the second example which you need to know? So we also have autoimmunity or autoimmune disease. So remember, whenever you hear chronic, we're talking about the abnormal part of inflammation. When we talk about acute, we are talking about the normal part of inflammation. Be vigilant as you are reading this topic. Yeah. So, what are some of the autoimmune disease which you can know or which you see that this is an example of chronic inflammation? So, an example is rheumatoid arthritis. So, rheumatoid arthritis is one of an autoimmune disease where your body starts to attack its own tissue. So your body starts attacking its own tissue. Its own tissue. So that is the second example of what? Chronic inflammation. Then the third example are allergic disease. For example, we have asthma. So asthma is one of the examples of chronic inflammation. So now that we have concluded our chronic inflammation topic, we are going to summarize, or I'm going to now show you how you can study this topic in what? In under 30 minutes, or how you can revise it in less than 20 minutes. So the first thing you need to know is the definition. What are the definition of acute and chronic? So you just know that acute is normal, chronic it is abnormal. So when we say acute, it is an immediate what? Response to tissue injured. Then we say what now is chronic. So chronic, this is a longer duration response to ongoing what? Tissue damage. So this is immediate, this is long. So you are done with your what? With your definition. Next, you move on to the characteristics. What are some of the characteristics? How can you distinguish acute from chronic? So we said that acute is what? Rapid onset. So we say rapid onset. Then we said when we talk about chronic, this is what? Persistent. So this is how you can be studying. So you know that acute is rapid, chronic it is persistent, it lasts for weeks, months, years. Then when we talk about rapid, it only lasts for minutes to hours. Then you go back. When you talk about acute, it is localized, meaning it only affects the area which has the disease. Then when we talk about chronic, we said chronic is what? Systemic. It affects multiple organs. So this is how you can be studying a topic of chronic inflammation. You need to know the points which can help you remember the bigger point. Then we also said what? Acute is what? Self-limiting. What do we mean when we say acute inflammation is self-limiting? We say that it can heal on its own. But when it comes to chronic, we say it's maladaptive. Meaning, chronic inflammation won't heal by itself, but it will lead to development of other diseases. So this is how you can be studying. You are even explaining to yourself or find someone to explain. Yeah. Then we also talked about one final point, which are the cardinal signs. So the cardinal signs, I'll talk about them at the end of my part 3 video. So don't forget to also watch my part 3 video for inflammation, where now I summarize the processes involved in inflammation, and we'll talk about the signs now. Then the final part are the what? Are the examples. So what are some of the examples of acute? So we said that acute, we can have a cut or wound. Also we can have burns. Also we can have what? Pneumonia. Here we have only one disease, which is pneumonia. Then we can also have insect bites. So remember this. So these are some of the examples of what? Of acute, in which acute can occur. Then when you hear the word chronic, just remember that these are diseases. First, we have chronic diseases like TB and syphilis. Then we also have autoimmune disease like rheumatoid arthritis. So you can write this table and review it. You will be able to study the entire topic of acute and chronic inflammation, the types, in less than 10 minutes. So this is where my part 2 video ends. Don't forget to watch my part 3 video, where I'll talk about the processes involved in inflammation. We also look at the outcome of inflammation. Then we end the video by looking at the 5 cardinal signs in detail, in case you get a question on the 5 cardinal signs. So don't forget to hit the bell button so that you don't miss out my next video.